Imagine a hospital emergency room. Doctors are desperately trying to save a patient, but suddenly, one by one, every doctor and nurse standing near her collapses, as if an invisible poison is spreading through the air. This isn't a scene from a horror movie. This is a real incident. The year is 1994, America's most terrifying and mysterious case, known to the world as the Toxic Woman of Riverside. On the night of February 19, 1994, an ambulance arrived at Riverside General Hospital in California. Inside was Gloria Ramirez, a 31-year-old woman suffering from the final stages of cervical cancer. She was extremely weak and struggling to breathe. Doctors immediately began treatment for fluids, sedatives, and oxygen support. But within minutes, the staff noticed strange and disturbing signs. Gloria's skin was oily and shiny, almost as if coated in some chemical. From her mouth came a sweet, garlic-like odor that no normal patient should emit. When a nurse attempted to draw her blood, the syringe released a strong chemical smell, and inside the blood were tiny shimmering crystals floating. Everyone was confused, but the situation turned terrifying when the hospital staff began collapsing one after another. Nurse Susan Kane fainted right after drawing blood. Then respiratory therapist Maureen Welch gasped for air and fell. Dr. Julie Gurchinsky felt chest pain and violent tremors before collapsing as well. In total, 23 hospital workers became sick, and 5 had to be hospitalized. The ward was evacuated, because being near Gloria now seemed like a danger to life itself. Doctors wearing special protective suits continued treatment, but at 8:50 p.m., Gloria Ramirez died. The official cause was listed as cancer complications and kidney failure. But the real reason, still an unsolved mystery. The media quickly gave the case a chilling name, the Toxic Woman of Riverside. Scientists suggested different theories. Some claimed Gloria had been using a chemical ointment for pain relief, which, when combined with hospital medications and oxygen, turned into a deadly toxic gas. Authorities dismissed the case as a rare chemical accident, but doctors and nurses who witnessed that night still insist. What they saw cannot be explained by normal science. And the most haunting part, even Gloria's full autopsy report gave no clear answers. More than 30 years have passed, yet the truth remains hidden. Was she just an unfortunate patient caught in a bizarre chemical reaction? Or the victim of a secret government experiment that cost her life? History will always remember Gloria Ramirez as the woman whose very presence was a threat of death, the Toxic Woman of Riverside.